Hi everybody, this is Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking about asthma. Let me give you some statistics. 38 million people in India suffer from asthma. As all other statistics, I'm sure this is underreported. But this one isn't. 40% of global asthma deaths come from our country. This is obviously a very serious condition that we have to talk about, we have to educate people about. And for that, we have our lovely doctor, Dr. Vora. Thank you for joining us today.
Thank you.
And we have two lovely ladies. We have Ishika, who's all of 21, and we have Yamini, who's all of 19. So we will get to your stories soon. Let's start with the basics, Dr. Vora. What is asthma? What causes it?
When you say 42% of global mortality, roughly, if I tell you last year, 2 lakh people died in India because of asthma, which would mean, if I make very rough calculation, maybe 25 people would die by the time we finish discussion on asthma. That huge is the problem. And the beauty is, asthma can beautifully be controlled. You can live with your asthma. You can have perfectly normal life. Asthma means dumb. Asthma means allergy. You find all funny names in society. Dama, allergy, bronchitis, infective bronchitis, seasonal bronchitis, infections. It is not given proper terminology and healthcare. We are responsible for not labeling it. Kai bar, when a child comes, we sense it is asthma, but somehow there is a fear of revealing diagnosis of asthma. Somehow there is fear that what would family say, how would they react?
Right.
And that label is not given. Unless you put that label, that child will continue to suffer and they would be diagnosed with asthma only when they grow old, when their full investigations are done and they are put on treatment. So the journey starts right at the childhood. Causes: pollution, genetics, and there are various triggers. So you have change in the season triggering your asthma, your hormonal status, your psychological status, your work pressure, and a lot of dietary habits, your lifestyle changes, it all contributes. So asthma is not like one etiology and one, it's not like your Anopheles mosquito biting you, developing malaria, but multiple factors would be responsible in asthma development in that particular case.
What are the symptoms one should watch out for?
So symptom is, on one hand, asthmatic could be completely symptom free, because as you know, Bhagwan ने एक पूरा lung extra दिया है. You have one extra kidney, one extra eye. So by the time your significant lung function is not compromised, you don't even know.
Right.
Especially when it comes to young children, they may have only cough. They may have only seasonal, that wheezy chest. They may have seasonal cold. They may go to family doctor, are given treatment for a shorter duration, not investigated, not diagnosed. So asthma symptom, as I said, completely symptom free. On the other hand, you have cough, chest pain, wheezy chest. You have that sound, that whistle coming from your chest. You have difficulty in climbing stairs. You have nocturnal issues in the sense, raat ko midnight they have to get up, short of breath, gasping for breath. This is asthma.
So those are the things we should watch out for. And what is the youngest patient you see with asthma?
Don't ask. Don't ask. It is seen in children. Young lung is under development. So when you have children developing it, it may be because of their early immunity, they're not developed enough, robust fighting system, and you get this. It takes generally first couple of years of observation to label this as asthma, and a lot of children outgrow their disease. So suppose आपके घर में pets नहीं है, suppose आपके मम्मी पापा को asthma नहीं है, suppose if there are no smokers in the family, suppose immunity is good, you're vaccinated well, and a lot of things are taken care of, environment supports you, suppose during that time, a lot of them outgrow their disease by about 7 or 8 years of that age.
Right.
So you have a suspicion of asthma in them, but they may outgrow their disease, only to develop sometime in future when in women, whenever there is whenever they begin with their menstrual cycles or whenever there are hormonal changes, obesity
So it's just lying
happenings.
dormant within you and then it resurfaces.
So you have a genetic predisposition. If you're in that particular environment, you may develop it. If environment is on you, then probably you may not get it like that.
Got it. So those are the things we should watch out for. What's the treatment? I mean, we always think of an inhaler when we think about any asthma patient.
So inhaler has changed the way we look at asthma.
Yeah.
It has been a big game changer. I remember my early days when I was a student, I was told asthma is episodic disease. Asthma is all spasm. And in last 30 years of my journey, I've realized asthma is inflammation. It's a chronic disease. It's going to remain with you. And contrary to my earlier belief that you would need treatment only during your exacerbation, only when you have cough and wheezy chest, now we have come to understand that your treatment should be lifelong. If not lifelong, for a pretty long period.
So are you trying to say that you can never treat asthma or reverse it?
Yes,
It's a
you can treat
lifelong.
asthma, but you can't cure them of asthma. It's like your blood pressure, it's like your diabetes,
So you have
it's
to
like
live
your
with it
acidity,
throughout
you have
your
to live
life.
with it. But then, if you follow certain do's and don'ts,
What are those do's and don'ts?
well, make friends with asthma.
Accept it.
Accept
First
it.
step to everything is acceptance.
Absolutely. So, when I have patients coming with me,
Yeah.
and when I tell them you have asthma, no, we don't have asthma. Nobody in my
Denial.
family has asthma. And I say, I can't treat you. You accept your disease first, and then treatment begins. So, first accept disease, understand it, read about it, gather, and now it's available at the tip of your finger. You can get
Absolutely.
best of the information
Yeah.
about your disease.
Yeah.
And then you know that with seasonal worsening, it can happen with certain food habits, with certain pets in the family, with certain smoking, etc. And a little bit of exercise, you could modulate your disease. You need to get your regular consultation done. There is something called as lung function test, spirometry test.
Right.
It's a very simple handheld test. All you have to do is just blow into it, and it gives you your lung capacities. And based on that, you modulate your titrate your treatment and continue
You can
your
lead a
treatment.
very,
And
very
you can live
productive
absolutely
life.
normal.
Is there a correlation between
Yes, there is a
allergy
correlation.
and asthma? Because they say allergic asthma, very often they're used together.
Correct. So then asthma has got again a big umbrella disease. So you may have an allergic asthma. Now suppose I tell you allergic to dust. क्या करेगी? Are you going to clean Mumbai of allergens? Are you going to make Mumbai
You have
dust
to live
free?
with it.
You have to live with it. And I feel this dust is causing problem in your system. It's your system that needs to be addressed, not the dust. So yes, allergy testing may have some role to play, but in my limited understanding, I don't much ask for allergy testing.
Correct.
I don't much rely on allergy testing. In small subset of patients, yes, who are not responding to my conventional line of treatment, I think there is something missing. I would ask
You'll
for
do
it.
that.
There are some common allergens, वो bed bugs होते हैं, वो
Correct.
mosquito
Correct.
coils आप use करते हो. Main thing is pets, dogs and birds. They can
Cause
aggravate
allergies to you.
asthma. So then suppose if you have asthmatic in family, one need to be cautious about those things.
Tell me, we spoke about different types of asthma, and you said allergic asthma is one type.
Correct.
What are the other types or subtypes within asthma?
It is mainly, so there are some clinical subtypes. Somebody who's young asthmatic, somebody who develops asthma at little later part of their life, we call it as adult onset asthma. Some asthmas are seen with just seasonal change.
Right.
Some asthmas are seen in a particular, say, a lady who's obese, etc. So then obesity related asthma, we call it. When we look at asthma as a clinicians, as a doctors, we talk about allergic or atopic or something called as eosinophilic asthma, and then there are non-eosinophilic asthma. Non-eosinophilic asthma is little less common. They're more difficult to treat. So they undergo a lot of exacerbation. They require a lot of hospitalization. They use a lot of healthcare efforts are made to help them get out of those episodes.
Right.
So these are the two basic
Got it.
allergic and non-allergic asthma.
This is fantastic. Why don't we move on to our two lovely ladies here? Ishika, let's start with you.
Right.
So, at what you're all of 21 now. At what age did you first detect asthma, and how's it been for you since then?
It was because of pollution, I believe, because I used to live in Delhi and everyone knows how polluted Delhi is. So I detected it at the age of 5 and 6, and it was bad at that time. As if you have heard of some asthmatic patients, they need to be rushed to the hospital. Even I
Right.
had that episode once that I had to go to hospital and I was out of breath. And considering that, I felt very helpless at that moment. Even my parents were helpless. I was starving for breath. Where we live now, they have factories around my place.
Oof.
And they release these harmful gases. And sometimes right now also, not being asthmatic, but still I have breathing issues. Now, if you know, in November, October, these months are the harvesting times. So they burn pollen harvest, the farms, and these things affect person who is weak to this
Right.
particular situation.
How has it affected your life in general? I mean, you're all of only 21, but still, like, what are your, thoughts around how it's impacted your life?
So it goes on and off. It keeps me worried that am I okay with this situation? Will I be okay in the future? Or when will it get triggered? So even in the house, whenever we burn that agarbatti and all,
Right.
sometimes some smells triggers me and it hurts my brain. Moreover, it gives me issues while breathing. So I get very worried that I need to carry my inhalers no matter
Right.
what. Even though I'm not asthmatic, but I think that I need to be secure. I need to carry this inhaler with me just in case I need instantly.
So there's
What
always
will
a
I
little
do?
bit of fear that
Yes.
when am I going to get my next attack? And
Yes.
I
Yes.
connect
Yeah.
it so well when children come and tell me, Uncle, tomorrow is a birthday party. Can I have just one sweet? Can I have just one glass of thumbs up? Can I have just one cake piece? And asthma robs of simple joys in your life. I mean, they're not asking me to climb mountain, or they're not asking me something which is undoable. They're asking me simple things.
But cake and thumbs up से क्या होता है asthma?
Oh,
Trigger
asthma
होता है?
of course. Food triggers, especially cold thumbs and thumbs. Cold drinks, useless. So one must not.
Regardless, not have it.
Yeah, absolutely not have it.
So what are the kind of foods that, of course, cold drinks, soft drinks, you did tell us.
absolutely.
But what are the other types of foods that asthma patients absolutely cannot even touch?
By and large, luckily in our Indian culture, not many food which triggers asthma, and at least in most of the houses there is concept of fresh food. We don't much eat those frozen food and food which is kept in freezer for days together, etc. But yes, we've seen coloring agents. So then you have that pastry with that, I don't know, red and green and color decor, etc. That triggers asthma. You've got, suppose you go to a mall and pick up a sauce which has got 6 months expiry, and there is some sauce which has got 2 years expiry. All those preservatives which are kept
Right.
would trigger asthma. A lot of sea products and seafood has the potential of triggering asthma. Otherwise, most of this Indian food is very well tolerated. And but in a particular case, you may have to go in depth. Suppose the patient is not responding to your anticipated outcome is not there. Then I would go in to look at all those extra things, and I would try to figure out what is. So, what I need to convey is, food has a role to play.
Correct.
And rather than looking at what all, there is a potential of food triggering your asthma. One has to keep that in
Keep
mind.
that
So
in
if your
mind, then you
asthma
have
is
to
not
figure
under
out your
control-
own sets of
Correct.
food that is triggering it.
And if you really go into this history, when children like them come, you ask parents would tell you, अरे हर वक्त द्राक्ष खाने तकलीफ था जी. You know that, they will give you that. All you have to do is
Correct.
spend some time with them, and you get clue to
Because
their
they know
pattern.
which are the food
Of
that
course.
triggers it. That is very
So I
true.
tell patients to keep a small diary. Say you have asthma exacerbation today. Last 4 घंटे में क्या किया था? Note it down. Put it down on paper. It may be as simple as you add whichever coconut oil, or you add this perfume, or you ate this, whatever you wore, this particular cloth. Keep a check on that, and maybe 3-4 episodes like this, you yourself will find out common
So it's
things.
not just food. What are the
Anything.
smells? What is the material
your
that you
soap,
wore?
Your क्या बोलते हो? Conditioner and
Conditioner,
shampoo. I'm blessed. I
shampoo.
don't have to use any of that. So then you girls will have to use that. So then all those
Any
things
of
can
that
trigger.
could trigger, and
Yes.
it's your own individual journey to figure out what is it that you need to avoid,
Correct.
which is where the journal helps.
Absolutely.
Oh, that's fantastic insight. Thank you, Ishika, for sharing your story.
I would also like to add a point. So
Please.
now, as teenagers or maybe young people, we go around with the people who are at our age, and like
Smoke.
90% of them smokes.
Right.
Now the issue is, now we are hanging out with them. They are smoking and it's causing issue to us. Now if we ask them not to do it, most of them won't understand the issue and they make fun of it, that asthma hai, ye to
Agreed.
hota hi rehta hai.
Yeah.
But they need to understand people who are weak at this situation, who are facing this issue, needs to be taken care of. I mean,
That
smoking
is
should be
such
stopped for
a
them.
brilliant
Yes.
insight and advice.
This is daily story. Children come and talk to me about it. All you have to do is stand in such a way that they don't smoke on. So whenever they are smoking, you stand in such a way that smoke probably doesn't come on your face
Yes.
directly. Or I tell them, why that? Puja. Ghar mein puja is such a thing where grandmother would want to sit however asthmatic she is or however dyspneic she must be,
correct.
right? So I tell them, okay, attend. What you do is have a stand fan pankha with the stand and let it blow on you. So that, or maybe keep it behind
So
you.
it's a very
So
practical
that all those
solutions.
fumes do not come to. There are small things you can do.
Yeah.
Air purifiers, I've started liking air purifiers nowadays. I tell them you put air purifiers, wherever
Everywhere
possible.
that
Small
they
things.
can. Yamini, let's talk about you. You're all of 19, right? And you said you detected it just about 5 years back when you were 13.
Yeah.
Tell us about it.
So, like doctor mentioned, allergic bronchitis, this, that, there are so many different terms. So, I think growing up, I did have like wheezing problems or breathing issues, but it was just all not termed as asthma. Like, I was never told, oh, you have asthma, because it never reached that level. Like he
Right.
said, sometimes there are things that trigger, for example, colored foods or like artificial flavors. Even I think Szechuan sauce is like one of the
Yes.
triggers. Yeah. So, I think growing up, I always had that, but it was always like, maybe it's a cold and cough, a viral, like let's do homeopathy, whatever. So it was all in control. There was nothing like excessive. And I think 2018, I think I was 13 years old. Yeah, I was in December and the weather was playing a role. And I think I must have eaten something that triggered it a lot. So like one night, I just couldn't breathe at all. Like I was gasping for air. I couldn't breathe. So I went to the emergency room in the hospital and they were like, yeah, we might have to admit you because my oxygen level was 85. I had to like get nebulization done, all of that. And I think like I was very insistent on not getting admitted because I was so scared. Like I was 13. I was like, I have school tomorrow. I have this, I have that. I can't like, miss anything. So I was in the hospital for around like 5-6 hours and then they let me go after my oxygen level came back up. But then, I visited a chest specialist and then he's like, I think now you should get onto inhalers. I don't think asthma affects my life like fully, like, oh, I can't do this, I can't do that. I think I can do everything. Maybe just when I feel like I'm gasping for air or like I'm unable to breathe normally, I'll have it like, and I'll be fine. Like the next day I'm fine. I don't need it the second day. I just have it once and then I think for a long period of time, I'm fine. Maybe because something has triggered it. Like maybe if I've had like a Coke or a thumbs up, which I wasn't allowed growing up. So now I want to have it more. Now that I'm allowed to have it and I don't have to tell my parents that I'm having it, I want to have it more. So maybe if I have like a Diet Coke, then the next day I'll feel it.
Right.
So I try to avoid it as much as possible, but then like at a party, you're just like, okay, like one.
After all, you're a teenager.
Yeah, like
you
one
have
is
to
like,
be a little rebellious.
like one can is fine. So yeah, just that.
So a small suggestion. So whenever next time you're partying, don't have a chilled one. Don't put a lot of ice in it.
That's a good
Put
point.
it in a glass. Allow it to stay there for a minute or so.
Right.
And then have only few sips of it.
I love the advice he's giving the two of you because he's like, there are certain things you can't control, so it is lessen the impact in terms of the negative impact,
And like he said, when you have an inhaler, you can like live with asthma all your life. I don't see it as a problem. I don't know why some people are so in denial of it. Because it's not a problem. It's like, even if you have excessive asthma, it can be controlled. Like I've seen people, I've been friends with people who used to have like those panic attacks and like before the math exam, she'll have this panic attack and gasp for air and stuff and then she'll have a pump or an inhaler and she'll be fine in the next like 15 minutes. It's just sometimes at night if I feel it or like in the morning when I wake up, I'm like, I'm feeling a little short of breath, so I'll have it. But I don't have to carry it around.
You have
anywhere.
a very mild intermittent asthma, it is called in our language.
Probably,
when we label it, it is mild intermittent. You're fortunate.
But talking about, in her case, she's fortunate that it's mild and it's intermittent. What is the most chronic form that you've seen? Where it's really debilitating to people's lifestyle?
So now, as I said, what happens to her tomorrow, we do not know. In which part of the country she's going to live, we do not know. What's going to be her weight, we do not know. But then she has a potential, or she has a diagnosed asthma in this case. I'm very happy that she's symptom free, but then that's not enough. You need to do once in 6 months to a year your spirometry. Look at your lung function test, and if that is normal, all your parameters otherwise are normal, then only I would label them as asthma in remission. That means the asthma at this stage does not require any treatment. But don't just feel fine by your perception that there is no disease.
Like keep getting checked very often.
But then asthma takes time to develop.
What is the most chronic case you have seen where it's been absolutely terrible and debilitating in terms of their daily life?
Both of them said they had acute exacerbation which required them to rush to the hospital.
Right.
Where their oxygen level fell. This episode had a potential of taking your life away.
Right.
We could have lost them during those episodes. Right. They are fortunate and they were young. They did not have any other comorbidity. The heart is normal, kidney is normal, diabetes nahi hai, blood pressure nahi hai. They recovered. Every time it will not happen like this. So, as disease progresses, it limits your lifestyle. It limits your capacities here. चलने में तकलीफ होती है. You know, a lot of senior grandparents come.
That
and
is
tell me,
with age.
I just want my grandchild. I want him to, you know, be with me in the garden. मुझे खाली उसको garden ले जाना है, and this pleasures are robbed off. So if you can live with your asthma absolutely fine, provided you take your treatment. If you don't, it will lead to that shortness of breath on your daily activity. So you can't go to washroom without support. That would be the state. And unluckily, it's not like your heart disease. When one attack, khatak, and you're gone. You will live with your asthma. Every time you suffer, and it is so difficult to see you gasp. For your family members also, imagine what would have happened to their parents when they had this episode.
Yeah.
So that is the agony. And सबसे ज़्यादा तकलीफ तभी होती है when you know that you've got fantastic treatment available and this all is controllable, treatable, manageable.
Yeah, absolutely. No, this is fabulous. I mean, thanks for sharing so many insights, all three of you. That brings us to the end of another fantastic episode. These two lovely ladies, just so bright, so positive, and with such wonderful wisdom and information. Thank you. And Doc, here, your sense of humor, your timing is just impeccable. And like you rightly said, if you want to climb the Himalayas or climb any mountain and not just conquer the mountain, conquer yourself, the key is to get educated, to get treated on time. And that's what we all want. And that's what we should try to educate and inform everyone around us that this is treatable. You can have a great life. Let's do that. Thank you.
Thank you.
बनके उड़ना है तितली